Hey, how's it going? I am Jeremy, and I wanted to talk to everyone about COVID a little bit more. I have a friend who's seeing this woman, and she's come down with COVID, and it's been a large topic of our discussions as of late, and so there's a lot of things that we want clarified. I'm older, he's older, she's older. She's in her 50s. Fairly good health though, but she seems to be having problems with it. She's in the hospital. She's the only person I know who's had to go to the hospital. His kids and grandson have had COVID and got tested for it. His oldest daughter didn't have to go to work for a while, or couldn't go to work for a while. The boys, whenever they got it, they weren't in school, so it didn't affect them too much. They just, They coughed, they were hacking a little bit, they weren't feeling good, but I mean, it wasn't much. It was just the flu, and the only reason why they knew about it was because whenever they did the testing, they were like, oh yeah, you've got COVID. So anyways, I wanted to make this because I want to get some of this cleared up. I've kind of avoided it a little bit just because there's just not enough time has gone by to really know anything. There's enough time that's gone by now, I guess, where we should definitely know some things. I have quite a bit of information here. I have the word pad up above me. I was trying to figure out how I could make this smaller and a little bit less, but I really kind of like everything that I have here. So I wanted to start off by saying, as always with all of these, because I have it at the beginning of all of my notepads, is that I'm not trying to change anyone's mind. That's not it. This is about showing lies, whether people are intentionally lying or not. That's not the point. It's to show that they are lying. And so I just leave it open for the people that I bring this information, and then you can talk amongst your friends and families about what is right or wrong for you. I don't know you. I'll never know you, just because it's just literally impossible. And so I'm just trying to bring the most accurate, up-to-date information possible. So what is COVID-19? I mean, it's pretty basic. It's just a disease that's going around. It's a respiratory problem. Okay. There's not really a side A or side B for the argument. At least not at this point in the discussion. You can break it down into other things, such as, well, you could break it down into, well, what about the mask? Should you wear a mask or not? The vaccine. Should or should I not get the vaccine? What about booster shots, closing down the economy? It's like, well, you can't make any of those decisions until you first have looked at, well, what is COVID? If COVID is really bad, okay, well, you're going to have a different way of thinking versus if COVID's nothing. If it's not really doing anything, so what is it? Is it this horrible thing that's wiping out half the population? Or is it just kind of like a lot of other diseases and problems that we have, where it's like, yeah, it sucks, but there's not really anything that we can do about it, and there's a billion things that can kill us. We're not from Krypton. We're not super men and women where we just live through everything and anything. So what have we done? This is April 3rd, 2020. And here are the states that have shut down non-essential businesses. At least 46 states have shut down businesses to slow the COVID spread. And here are the states. 46 states and DC have enacted policies to close non-essential businesses in an effort to slow the spread of the novel COVID virus in the U.S. To slow it. You know why? Because since the beginning, that's all, well, That's what they were saying at the beginning. That's not what they're saying today. And it was because it's like the cold, it's like the flu. It spreads really easily. Everyone's going to get it. We just want to slow the spread. And that's because if the hospitals get maxed out, but people are still needing hospitalization, these people who can't get hospitalization, they're really going to be screwed. So slow the spread so that if this is the limit that the hospitals can do, hopefully, everybody gets sick with it and it kind of caps and then it goes down and it keeps it underneath what it is that the hospitals can take care of. But now it's like they want, we need herd immunity, and they keep pushing that number up. It was like 75%, 80%, and it's like now they want 95% herd immunity. It doesn't seem to stop. So what did this do? Well, this created super spreader events. And so right here, because it's not COVID that did it. COVID's a virus. The COVID can't close down the businesses in any country. Not in the U.S. or anywhere. Just nowhere. It's the government that did that. It's the politicians who did this. And so they created super spreader events. So the government closed down the economy and created super spreader events at Walmart's, Lowe's, Home Depot's, Target's, and other large box stores by closing all other small businesses, forcing everyone into central locations. Because if you could have gone to a little store, you go and you shop there and there's only like a dozen people, it's going to be pretty hard to get COVID if there's just a handful of people. But if they've closed these small little places down and now you have to go to these large places where they have hundreds of people, thousands of people every single day that go there. And they're touching everything, they're coughing all over the place. Oh, well, yeah, it's going to spread like wildfire then. So the government didn't do any good with this at all. We've talked a little bit about all of this here too. This isn't the first time that I've done this, and that each time whenever I go over a topic, I want to add to this. And so some facts and evidence is that with the CDC right here, .gov, that during 2020 there were 375,000 deaths. Are you kidding me? That's it? Let me see if I can pull up my calculator here. I'm going to switch this out for a second. So if we have 375,000 deaths divided by 332 million people, that's not even 1% of the population. It's 0.001% of the population. I don't understand this. I do not understand this at all. That is nothing. It's just, I mean, how close do you have to get to zero? It's like, yes, it's 375,000 people. But that's spread out across the entire country. This doesn't even constitute one state. It's the entire country. Whatever. So what else do we have? Well, this is from the University of Chicago News. And this was an article in February 12, 2021, just a few months away. At least 50% of COVID-19 infections come from people who aren't showing symptoms, study finds. 50%? I thought this thing was deadly. 50% of people who have COVID don't even know about it? Is this thing deadly and horrible, or is it not? So that means that, oh, all these cases that are on the rise, that means that 50%, you take that number and you double it, and that's how many people that actually have COVID? That the symptoms are so mild and so ridiculously non-consequential that you don't even know it? Well, which is it? Well, let's read this. The University of Chicago analysis of spring New York City outbreak finds asymptomatic cases make up at least 80% of COVID cases. Okay, well, what? But they said at least 50%. Well, at least, okay. A new study out of the University of Chicago has found that during the initial wave of the COVID-19 outbreak in New York City, only between 1 in 5 and 1 in 7 cases of the virus was symptomatic. The research team found that non-symptomatic cases substantially contribute to community transmissions, making up at least 50% of the driving force of the SARS-CoV-2 infection. The results were published on February 10th in the Proceedings of the National Academy of Sciences, and I pulled it up right here. And so if you want to take a look at this, you can screenshot it. It's www.pnas.org. It's one of their articles, and if you want to read through all of this, you can. But it's astounding. You know, all of these people have COVID and they don't even know it. And this also explains, it's one of the reasons why so many people are getting it. Because just like I said a moment ago, that other article with ABC News here, it was to slow the spread. It wasn't a question of if you're going to get it or not. It's a question of when. So if we only know of 50% of the people who've gotten it, chances are pretty high that maybe you've gotten it already too, and you just didn't even think of it. You didn't even know. So if you're interested in having a full, clear picture, where it's not just a one-time rant, but where we continue to build up a case for this, which is what this WordPad is right here, you know, so we can keep going over this information to see what we really need to do, then I need you to do just one thing. Give the video a like, give it a thumbs up, and subscribe. That's all I need you to do to help me out. And so from the CDC here, we find out that there's 375,000 deaths from COVID. 655,000 Americans die from heart disease each year. I am not concerned about dying from heart disease. But yet, it's kind of close to being twice as many from COVID. I don't give heart disease a second thought. 480,000 over deaths are caused by cigarette smoking every year. And they used to say back in the day, I don't know if they still say it or not today, but that secondhand smoke was worse than smoking, because whenever you have your cigarette, there's a filter that's on the end that you put to your lips, and that filter helps filter out a lot of the toxins. So secondhand smoke is the smoke that comes out of the tip right there, and that was much worse. More people die from cigarette smoke than this. So what we should also be doing is banning cigarettes and pipes and every other thing that you can smoke, which includes marijuana, because all of this, it's smoke, it's toxins, all of it. It's before we had central heating and air, the only way that you could warm your place was by having a fireplace, and inhaling all that smoke from burning the firewood gave a lot of health problems to people, killed a lot of people. It's one of the reasons why we're living so much better, one of many. With cancer deaths, almost 600,000 cancer deaths in 2019. Are you worried about cancer? Now on this one, I actually am a little bit. But it's only because it runs in my family. My mom died from cancer. Her father died of cancer. If it wasn't for them, I wouldn't give a damn at all. And even though that it runs in my family, I'm not going crazy about it. It's like, yeah, I diet and exercise. I watch my health. But I do it for a whole bunch of reasons. Not just cancer. And for things that are also non-health. I just want to have plenty of energy. I want to be able to be strong and to be able to go out and do things and live life. And not to just be kind of like this this blob that just can't go out and do anything. There are 61,000 deaths annually of the flu. You know what? If you take that, well, we'll get into that again because there's another little chart here. There's 157,000 deaths from chronic lower respiratory diseases. Reported from the CDC. 145,000 deaths from other chronic lower respiratory diseases. I don't care. I don't give them two thoughts at all. None of these things. Even if you were to put them all together. I don't care. Okay, so I found this from the Joe Rogan podcast, Breakthrough Cases and Vaccine Passports. So we're going to listen to a little bit of this and we're going to pause it and take it apart as we go through it.
And this is the same guy that just passed this fucking law in New York City where you have to have a vaccine passport to go everywhere. You have to have a vaccine to go to a restaurant, to a gym, to any place where people gather. It is crazy. And meanwhile, the biggest percentage of people that don't.
And this is going to go in with straw man responses right here.
Don't have vaccines that have been vaccinated are people of color. So this guy, people of color and immigrants. This is what he's always supposed to be pro people of color, pro diversity, pro immigration. Those are the people that don't have vaccines. And now you.
Okay, so this isn't. It's not like this isn't something that you shouldn't talk about. But until you know what COVID really is, it's hard to have that discussion. So it's just like before, whenever I was saying, well, if a lot of people are dying from COVID, you're going to have a set of actions that you're going to take if half the people who have COVID are dying from it, versus, well, if nobody's dying from it, then I want a completely different set of actions. So if you're talking about strictly COVID, then this would be a straw man argument. So the statement would be something along the lines, people of color, minorities, and immigrants aren't getting the vaccines. This is racist, right? It's like, well, yeah, but we first have to figure out, well, what is COVID? What's going on with it? So if somebody brings that up, you can move into that subject if you want to, but just keep in mind that that's not COVID. So the response to that is that this is wrong for this topic, that we first need to look at what COVID is to find out just how bad it is. And if it is bad, then we can move on to talking about, well, are these policies that are being talked about and implemented, are they racist? But if it's not bad, and it's more like the flu, then it doesn't matter. We don't need to do this stuff in the first place. And if it's not bad, but they are having things like the vaccine passports, then that would be discrimination, and that's wrong. That's not good at all. But it's hard to say about any of this stuff if you don't even know what COVID is first. So we're going to get into this a little bit.
You're precluding them from going to gyms and restaurants, and what about the people working in the restaurants? What about all these? It's fucking madness. And then you have a bunch of people that are supporting it, like, yay, finally. Meanwhile, you have science is coming out. There's legitimate articles. Jamie, I'll send this to you now. There's legitimate articles, because doctors have been sending me these things. And, this is neither.
Okay. And so this one is going to go under studies and research, and number 4.
Pro nor con vaccine. This is not a judgment statement, but imperfect vaccination can enhance the transmission of highly virulent pathogens. Right. So this is a scientific paper from 2000.
Sorry, let me slow this down a little bit. I watch a lot of this stuff faster because there's just too much to go over.
And 15 that shows that
and so they have it right down here. Imperfect vaccination can enhance the transmission of highly virulent pathogens. And so I found this. This came from Penn State, so I found the article, but then I actually found where it came from. I don't care so much about the article as the actual as to where it actually came from itself. And so this is from Pennsylvania State research output. Imperfect vaccination can enhance the transmissions of highly virulent pathogens. So it's like, oh, okay. So could some vaccines drive the evolution of more violent pathogens? Conventional wisdom is that natural selection will remove highly lethal pathogens if host death greatly reduces transmission. And I know what this is. I've heard this before. Vaccines that keep the host alive but still allow transmission could thus allow very violent strains to circulate in a population. Here we show experimentally that immunization of chickens against American's disease virus enhances the fitness of more virulent strains. So in other words, what they're saying is that any virus that goes around and kills its host dies too. And that's why whenever you have the first wave of some virus that goes around, that's usually the worst. And people are going to die the most from the first wave. And the worst strain of that is going to die along with those people. Because, I mean, the virus basically committed suicide. Oh, I'm going to go into this animal, kill the animal, and I'm dead too. But when you give them the vaccine, this vaccine that keeps it alive and the host alive, then it's allowed to flourish and to change and to still stay real deadly. It's all, but if the people die, or the animal, in this case chickens, if they die from it, then the worst part of the strains completely die off, and it's only the weakest that get to survive. It's actually, in this case, the survival of the strongest comes from the weakest. So if you're asymptomatic and you don't know about it, that's the variant that's going to have the greatest success of all, because you don't even know that you have it. So how are you going to be able to take any precautions against it if you don't even know you've got it? That's not too hard to follow. Not at all. And so, all right.
Here's what important.
And so I have it here. So this is the 2015 Penn State Research Output paper. I saw this on the Joe Rogan podcast. And this is the podcast right here. I copied and pasted it right here. The title of the article, and then the actual Penn State paper right here. So what I'm going to do is at some point in time I'll create a website, and I will have all this information on the website, and people can look at it, and everybody can add to it. I've got a really good check and balances with all of this stuff. I'm not going to allow for any trolls. Everybody's going to have to be verified. I'm going to know who you are and who you're posting it. So if somebody is posting a bunch of nonsense, you're going to get banned. So it's going to, the website in essence is going to have all the information that's up to date and as accurate as it can possibly be. And we're all going to look at this information and be like, okay, well, where's the source and how good is this? And we'll deal with it. It's more than this, but yeah, good stuff.
Quote, vaccines that keep the host alive but still allow transmission can thus allow virulent strains to circulate in a population. So vaccines that don't kill the virus, vaccines that allow people, like this is one of the things we're finding out about what they're calling breakthrough cases.
Right.
So people who are vaccinated can still get COVID and they can still transmit COVID.
Yeah, and I've heard this too with COVID recently with all this vaccine stuff coming on out, and that's what we've been talking about too, is you know, should we be getting vaccines? What's the deal with this? And it's like, from what I've found out today, it's like, no, it's pointless. In fact, it looks like it may do more harm than good. It's like, what good does it do to get the vaccine if you're keeping these really deadly strains alive, and then it kills even more people?
Recently happened at the Comedy Store. A vaccinated comedian gave COVID to like 12 different fucking people at the Comedy Store. Some of them vaccinated, some of them not. That situation where the vaccine just kind of protects you from serious damage,
right,
but it protects you from really being like badly hospitalized or death, but doesn't stop you from getting the virus, can possibly lead to more potent viruses. So these people that are saying, oh, it's these unvaccinated people that are responsible for the variants. Well, there's actually scientific papers that point to the very sort of environment.
Now, I'll also push back on this a little bit and say, until it's been peer-reviewed, you got to kind of take it with a grain of salt. I know that's a big problem that's going on with like the humanities, where there are these people out there where they're making these claims, and they say, well, here's my proof, and they'll cite someone else's book where they don't have any kind of backing either. And whenever somebody actually does try to take everything that they use to measure these things, they can't duplicate the results. So I would like to say that this is 100%, but until it's been peer reviewed and somebody else has been able to duplicate this, take this all with a grain of salt. But this is better than nothing. I need something, right?
Environment that we're creating by having so many people vaccinated with a vaccine that doesn't kill off the virus. It actually can lead to more potent viruses. Try finding that story anywhere. Other than doctors, I'm getting PhDs sending me these things. Guys who won't speak about it publicly because they're worried about the blowback. People who are physicians.
And so that is good, though. At least he's getting it from several doctors instead of just one. So, you know, the more the better.
People who are even epidemiologists, like even people that deal with diseases and viruses, they're concerned. And they don't want to talk about it publicly because people call them anti-vaxxers.
Oh, yeah.
It's really wild out there.
Well, it's wild because they somehow managed, and when I say they, meaning the political elite, and then I think their established media representatives, have somehow managed to turn this into a political issue, right?
Okay. And so it's like, yeah, I agree with that too. So we go back down to straw man responses. So, COVID is a political issue. You know, if somebody's making this statement that the government and politicians need to get involved with this, it's like, no, because again, it goes back to, well, what the hell is COVID? What is it really? What is it doing? Is it really bad and horrible and everybody's dying like flies? Or is it really nothing? Until you know what COVID is, you can't be making these decisions off of nothing. And it seems like that's what they're doing. And so what's the response? For me, the response is COVID is a personal medical issue between yourself, your doctor, and your friends and family. And if you want to consider me a friend, by all means. That's your choice. I'm not going to tell you one way or the other. But until we know, you know, it's nobody's business. It's just like whenever my mom had cancer. It was nobody's business that she had cancer. She had a tumor in her brain. And whenever she had her first round with it, they had to zap her entire brain with radiation, and she went bald. And people looked at her and gave her looks, and she didn't like it at all. And she bought some wigs to kind of help deal with it. And it's like, you know what, mind your own damn business. You know what, she's still here. You need to treat her right. You need to just treat her like any other person. She doesn't want any of this special nonsense. You know, she's not some kind of boogie woman or something like that. Go screw yourself. You know, and that is discrimination. And discrimination, the bad kind of discrimination, is whenever you're discriminating against somebody where they have no control over it. So that's things like race, sex, color, national origin. You have no control over those things. You have no control over whether you're male or female with your X and Y chromosomes, whether you have a uterus or testicles. You have no control over where you were born, the color of your skin. You've got no control over any of that. You also have no control if you get sick or not. It's none of your business, and you've got no business treating anybody like trash because of any kind of disease that they have, or some kind of sickness such as cancer. And then they talked about as well, a vaccine passport restricts your actions. You need permission to work, to shop, to eat, and it takes away your freedoms. So again, these are all good and valid topics, but not for this. You're getting off topic. My response for this is that this is not about COVID and whether or not if it's bad, but it's a topic about personal freedoms and authoritarianism. It's like, have that discussion. Fine. But do you know what COVID is first?
Mm-hmm. And that's dangerous. Like, it's dangerous for any politician to play in that game where they're using something as meaningful and quite possibly dangerous for the country.
Out with everybody, and then they go to take a picture.
Yeah.
She puts the mask on and then takes it off after the picture's done.
Of
She
course.
had no mask.
Masks for the camera, but then they take them off.
AOC just got busted doing that yesterday. You see the video?
Yeah,
she
of course.
had no mask
Yeah.
on, hanging out with everybody, and then they go
Put
to take
it
a
on.
picture.
Yeah.
She puts the mask on, and then.
So I wanted to look in about this. It's like, okay, well, what about AOC? Did she do this? And I found this on Rumble, the Charlie Kirk show. I don't know who this guy is. I did a search for the video, and then I found it here, and I clicked on it. So here's AOC. Oh, what the hell happened? Oh, that was the end of it.
Let's
Sorry.
take a quick photo so we can keep the pressure up so other colleagues can come out here. Yeah? Great.
There she is.
New York crew.
Everybody.
So here she is putting on her mask. Nobody else has their mask on, or was there one other person? No, there's another guy. He put on his mask. Another guy in the blue over here is going to put his mask on for some damn reason. She's putting on her mask over here. This guy has his mask on. It's like, what are they doing? I don't understand this.
Housing is a human right on three. 1, 2, 3. Housing is a human right!
Oh my God, did they just say housing is a human right? No, it's not. The only human right that you have is to die. Housing is a government privilege that if the government does that, they'll do it by taking away your money through taxes to pay for housing. You don't have a right to a damn thing. That's a lie. They should be shouting, housing is a government right or a government privilege, which AOC can relate to with her job there. So it's just a platitude. And then look at that. I think, I don't know who this guy is, but just took the picture and took his mask off too. Took his mask off. Good job. I don't know who he is, but whatever. One minute later. There she is with her mask off. Again. So I'll have links in the description below on all of this stuff, so you can look at all this. I don't know who the Charlie Kirk show. I don't know anything about him. I don't support him one way or the other. I have no idea who he is. I just wanted that video right there. Oh, okay, yeah.
And takes it off after the picture's done.
Yeah, or they can have parties, what is it?
How about Obama?
Yeah, Obama's having that 700 guest party or
Right,
whatever
it's
it
only
is.
down to 600
Yeah.
because of the pandemic.
Yeah.
It's maybe a little lighter.
But
So I haven't heard anything about that. I decided to go ahead and Google that, and I found it. This is from the NewYorkPost.com. Title of it is, Imagine if this was for Trump. Obama bash for hundreds draws jeers amid Delta outbreak. Okay, well, isn't that nice? So why is this going on? Former President Barack Obama is creating a nightmare by trying to get nearly 700 people to his 60th birthday bash in Martha's Vineyard, a source told the Post on Monday. Well, that's great. So George Clooney, Steven Spielberg, and Oprah Winfrey are among the 475 guests expected to attend alongside about 200 hired hands. Well, that's great. If they're so worried about this, and why are they having these huge parties? Now, I'll throw it back on them, though. Well, there's Obama and Michelle there walking together without masks on. Maybe here at Martha's Vineyard, maybe they will all be wearing masks. I don't know when his birthday is, but maybe they will be. Because I don't think it's happened just yet. So who knows? Maybe they will. I'll give them a bump, but I don't know. Hopefully, I can remember to check back on this and to see what's going on. But it's same thing with that Lori Lightfoot. She got caught not having her mask at a social event. Who was it? Nancy Pelosi. Was she the one who got her hair done, or was that Lightfoot? And oh, what was that other woman's name? Not Nancy Pelosi. Not Chuck Schumer. There's another one where she got caught without having her mask. She's another well-named. No, whatever. I don't care. Anyways, continuing.
You can't go to a gym in New York,
Right.
unless you have a vaccination card. Or
Right.
you can't go out to eat. We're going to shut
go
down
to a
small
comedy club.
businesses. You can't go to a comedy club. And I think it's rules for thee and not for me scenario. And people read right through that shit. Because some people I think
people are
even
applauding it. Just
So this is the part where I was talking about authoritarianism, about that vaccine passport.
and give that power up.
no.
They're not going to. They're going to find a reason to continue to use.
And then he talks about, well, they don't give that power up. Government officials and the government in general and politicians don't give that power up. And it's like, that's not true. Because we know about prohibition. It was amended into the Constitution, and that got repealed. So don't say that they don't give power up. They do. May not be easy, but it can and it does happen. So don't give up hope in thinking that this can't be undone. This happened with the Patriot Act, with George Bush, with 9/11, and a lot of that stuff has been removed. I don't know if all of it has, but I know they've gotten rid of at least a large amount of it. So don't act like it's not. So
If they can figure out a way to force you into carrying papers, into carrying something that lets you enter business.
And just FYI, I am totally against this passport nonsense, and I agree with what he's saying. It is authoritarianism, it is discrimination, it is absolutely bad and horrific. There's no reason for it. So we'll keep going into more of this stuff. We're going to bring up stuff from the CDC to show what they're saying about this.
Businesses, or lets you do this, or lets businesses open. As soon as you give politicians power in any kind of
I think that's the history of lawmaking and political power in the United States. And I think, how do I preserve more of my freedom? Because I feel like dual philosophy, when we have to have certain laws, we have a really hard time relinquishing.
It'd be easier to just tell you shut the fuck up, do what I say, and you have to. You can't work anymore unless you do what I say. That's essentially what a vaccine passport is.
Right.
You can't do what you want to do unless you do a vaccine. Can't go to work. That's ever existed. Greatest machine of art and creativity and innovate. But as soon as you put the boots to them, happening. That's what's going to happen with a vaccine passport. It's not. It's not, because apparently it's a small number. I don't know what the numbers are, but I know that most people catching COVID that had a vaccine, right? That was the whole idea. You get a vaccine, you don't have to worry about it. Now we know not only do you get it, but you can spread it. And some people have died. Apparently it's a small number. I don't know what the numbers are, but I know that most people who get vaccinated, when they do have the disease, they have a better time of it than the people who are unvaccinated. But where are the people out there calling for people to get healthy? Where are the people out there calling for people to lose weight?
Okay, so exactly what are the people with their numbers out there? Oh no, it's over here. And we already went over all that about how many people who died. We're gonna get into this stuff about it where he's talking being fit.
Hey, 78% of the people in the ICU for COVID are obese. 78%. Where's that?
Okay, 78% of the people. So CDC study, 78% of the people in the hospital with COVID. And yep, here's CNBC COVID CDC finds about 78% of people hospitalized are obese, been overweight. This is MSN. CDC finds 78% hospitalized for COVID. CDC finds 78% of people hospitalized for COVID. This is from Fox News. So we're going to look at CNBC. 78% of people hospitalized for COVID were overweight or obese. About 78% of people who have been hospitalized, needed a ventilator, or died from COVID-19 have been overweight or obese, the Center for Disease Control and Prevention said in a new study on Monday. Just over 42% of the U.S. population was considered obese in 2018, according to the agency's most recent statistics. Overweight is defined as having a body mass index of 25 or more, while obesity is defined as having a BMI of 30 or more. So what does that mean? I'll show you. So this is the old tried and true way. They now claim that there are these scales and machines where you can get on it and they'll tell you what your body fat percentage is, and that doesn't seem to make any sense to me at all. I've read up on that stuff and it was like, no, it doesn't. That just doesn't work at all. And you just can't look at your weight to understand this. So an example of this is that whenever I was in the Army, I was a 19 Delta Cavalry Scout, you would have to do a PT test, a physical training test. I think it was twice a year, once every 6 months. You had to do a run, a 2-mile run, and you had to do push-ups and sit-ups for 2 minutes each. You had to get a certain amount, and then you also had to be, you had to go and they would measure your height and take a look at your weight. And there was this one time whenever we got this new kid in from basic training, and he was too heavy, he was too fat. And so they said, all right, come on over here, we're going to get the, like one of those little tape measures, but it's for fabric, you know, and they measure out how wide your arm is and your waist and your chest, and they figure out how much body fat that you are, and you use one of these things and it clamps down on your skin in certain locations to see how much fat that you have. This guy takes his shirt off and he's got a 6-pack. Everybody starts laughing. It's like, yeah, you fat, you know, oh, you're horrible, get that. They didn't even bother. They were like, no, you're good, you know, just get on out of here. You know, it was hilarious. But with this, it's just like 10, 20 bucks for this thing. Came with this. It has a male side and a female side, and it's divided up by your age. And what you do is, there are 3 places where you measure on your body with the calibers. One is kind of right under here on your chest, close to your arm. Another location is to the side of your belly button, and then on top of your thigh. It has measurements right here. You add the 3 up, you divide them out, and then you look on here, and that'll tell you what it is. And so for me, for example, oh, it has your height and your age. So I am in my 40s. Or no, it's your height, or it's your age, and then what your number is, I believe. Yeah. And I think mine, I haven't done it in a while. The sum of the 3 skin folds. So if it's over 180 mm, please consult a personal trainer. Oh yeah, and so that would be the max. I know I'm kind of low. I've done much better because I was having problems. But this is how you find your BMI. And it doesn't cost very much. And this, it doesn't lie. My appetite lies. My appetite tells me all the damn time that I'm hungry and to stuff my face, but that doesn't lie. So does a scale. Don't ever let anyone tell you not to jump on the scale. You jump on that damn thing all the time. You get hungry, you go get on that scale. That scale will tell you just how fat you are. And then you can decide, well, do I really need to eat? It's like, no, probably not. So right here, underlying clinical conditions and severe mental illness among roughly 500,000 adults hospitalized with COVID-19 from March 2020 to March 2021. And so this is from the CDC, Center for Disease Control and Prevention. And it just goes on to talk about, and this is the same thing with that University of Chicago. They have the abstract, introduction, methods, and results and all this. And yeah, it talks about how that you are going to have more problems if you're obese. That if you have respiratory problems, if you have diabetes, and so here we go. If you have hypertension, which is caused by being overweight, lipid metabolism, obesity, diabetes with complication, coronary or other heart disease, which is also caused by being obese, and all kidney disease, which it does not help if you're overweight with this. If you're overweight, you're going to have kidney problems. Anxiety or fear, if you're stressed out about it, that doesn't help either. Bronchitis, depression, obesity. COVID-19 vaccine breakthrough case investigation and reporting. This is from the CDC again. Vaccines are effective and are a critical tool to bring the pandemic under control. And then get this. However, what do you mean, however? No vaccines are 100% effective at preventing illness. Some fully vaccinated people will get sick, and some will even be hospitalized or die. Well, so then why are we taking this? Because we just did the math on the calculator, and it was 0.0011%. And so this, I mean, even with those few people, this is still going to have a chance of killing you? However, there is evidence that the vaccination may make illness less severe for those who are vaccinated and still get sick. Well, you know, they just talked about too, and we saw that research paper from Chicago, that if the vaccine keeps you alive, but you have an extremely deadly variant of the disease, that it's going to give it the opportunity to mutate instead of die, thus hurting even more people, possibly even killing more people. So the risk of infection and hospitalization and death are all much lower in vaccination in people who are vaccinated compared to unvaccinated people. Great.
That information being shared. Where's someone who's a leader who gets on TV and says, ladies and gentlemen, we've got to decrease our body mass. We've got to decrease our fat. We've got to make sure that people aren't overweight. We've got to make sure that people are healthy. Walk around your block. You don't have to do something complicated. Start drinking more water. Stop eating sugar. Start taking vitamins. You can increase the strength of your immune system. We can fight things off better. We can be a healthier civilization.
Yeah, and this is why I manage my health, my diet, my exercise. Because not only for COVID, but it's for all this stuff. For heart disease, respiratory, type 2 diabetes, all this stuff. All of it. It helps you out in all facets of your life. You want to live longer, you want to live healthier, stronger, be more energetic, then you have to watch this. You have to do something about it.
Better for everybody, right? You don't hear a peep. All you hear is, take this vaccine that doesn't even prevent you from getting the disease, or you can't go to the sauna, wherever the fuck you want to go. You can't go to the Broadway show. It's madness.
It's madness.
It really is madness, because if it was a vaccine that really is it's more of a treatment than it is a vaccine, really, if you look at it. Because you're saying you need a booster now every 6 months. Look, if you get vaccinated for polio, you get vaccinated for the measles, you don't have to worry about it anymore. You're good. This is not...
Okay, so I wanted to look this up too. It's like, well, what does it say about this? So, vaccine shot for polio. Should my child get the polio shot? protects your child from polio, and again, this is from the CDC, the Center of Disease Control. Protects your child from developing lifelong paralysis from polio. It has some side effects here. Is it serious? How does it spread? Polio is very contagious, and yes, it is. Do people still get polio in the United States? No, thanks to a successful vaccination program. The United States has been polio-free for more than 30 years, but the disease still occurs in other parts of the world. It would only take one person with polio traveling from another country to bring polio back to the United States. That's great. So let's open up the borders and let's bring back polio. So what does this mean? Because I was like, well, if everybody's getting vaccinated for polio, then why do we care? Well, if you've got the vaccine, you're protected from polio, then so what if somebody from another country comes over here? So I got on Quora. This is the only place I could find anything. I looked at it a little bit online and just couldn't find anything just too real concrete. But this is from Richard Blunston. Upvoted by this guy in BBS MD, Medicine and Health and Prevention Medicine from West Bengal, India. Okay. So the answer is, so the question is, can you contract polio if you're vaccinated against it? And he says yes. The answer is yes, but there are two kinds of polio vaccines. One is a shot, and you can't get polio from it because it's dead, and the other is given by mouth, and it's a live virus. This means that the virus lives and multiplies in your body and does not make you sick, except when it does. About 1 person in 2 million given the oral polio vaccine will get vaccine-associated paralytic polio, so you'll get paralyzed. But only 1 in 2 million. It's like, yeah, whatever. Well, when you say if the oral vaccine can make you paralyzed, why would anyone use it? It turns out that the shot version that you get injected with does not prevent you from getting polio, and it does not prevent you from passing the polio infection to someone else, but it does prevent you from getting paralyzed. So, continuing, the oral polio vaccine does prevent you from getting polio, and it does prevent you from giving the infection to someone else. So the oral vaccine is much superior than the shot, except for that 2 millionth unlucky customer. So he goes on to say, if you are a medical doctor in a country with lots of wild virus polio, you're going to recommend the oral version, because it's the only way that you're really going to be able to stop the spread. But if you're a medical doctor in a country that's had no cases of wild virus polio for the last 20 years, and only cases of vaccine associated with the paralytic polio in the last 20 years, then you're going to want to switch your program to an all-injectable program, which is exactly what America did in the year 2000 for that exact reason. So I'm obviously older than that, so I guess I got the oral one because I think everybody was vaccinated for polio. I don't remember people not doing that for their kids back when I was born. So. But in many places in the world still need the oral vaccine to fight their active epidemics, even with the risk that 1 person in 2 million will become paralyzed from the vaccine itself. So yeah, can you still get it? Yep. Yes, you can. So from this CDC again, our progress against polio in 1988, and it's like, well, yeah, it was pretty bad. So in the purple, countries that have never eliminated polio, and then countries that have eliminated polio are in the gray, And then if it's crossed or have these little gray lines through it, there's no data available. So Antarctica down here and Iceland up here. So in 1988, it looks like all of Africa, all of Asia, about half of Europe, a lot of South America, Central America have polio going on. But in 2020, all it is, it's Pakistan and Afghanistan over here. Where does it say that? Okay, right here. The last evidence of wild type polio type 1 transmission in Nigeria was in September 2018, leaving only 2 polio epidemic countries having neither intercepted the transmission of indigenous wild polio type 1, which are Afghanistan and Pakistan. And so what's been going on lately in Afghanistan? We've been pulling out, and for some reason we are taking these people back to the U.S. I tell you what, they better be giving every last one of these people oral vaccines of polio, because we're not taking that. So or I guess if you're a kid and they bring these people back, it might kill you. Or even more likely to happen is that, yeah, you're going to get it and you're going to be paralyzed for the rest of your life. So, great.
On that, this is a totally different kind of thing. And it's a completely new kind of vaccine. The idea that people shouldn't be skeptical or nervous about that is kind of hilarious.
Well, it's kind of hilarious that people won't try on skepticism in general. Like, they need to be more skeptical. They need to...
Oh, and then I also wanted to look into the measles. Measles vaccine. Can I get the measles if I've already been vaccinated? This is from the Mayo Clinic. And they say it's possible but very unlikely. The combination measles, mumps vaccine is a 2-dose vaccine series that effectively protects against all 3 viruses. Oh, mumps, measles, and rubella. I don't know what that is. Never heard of that before. In fact, more than 93% of people who get the first dose of MMR develop immunity to measles. After the second dose, about 97% of people are protected. So, yeah, that's pretty damn close to 100%. The first dose of the vaccine is recommended for children ages 12 months to 15 months. The second dose is recommended before your child begins kindergarten or the first grade, around ages 4 to 6. If needed, however, the second dose can be given as soon as 4 weeks after the initial dose. Your child may need the second dose at a younger age. If you plan to travel abroad, infants ages 6 months to 11 months should receive 1 dose of measles vaccine before traveling. So, not quite 100%, but it's a hell of a lot better than what's going on with that. So here with CNN Health, about 5,800 people who have been vaccinated against COVID have become infected anyway. The U.S. Centers for Disease Control and Prevention tells CNN. Some became seriously ill and 74 people died. The CDC said it has 396, or 7% of those who got infected after they were vaccinated required hospitalization. So pay attention to what this is saying. This did not say 396 people got sick from COVID. It said that 396 went to the hospital. So the people who got the vaccine and got sick from it, it's more than this. This many people got the vaccine, this many people got the vaccine and also got sick from it, and then this many people got the vaccine, got sick, and got hospitalized. 7%. This is the CDC's first public accounting of breakthrough cases. And so breakthrough cases means the vaccine was implemented and it's still breaking through. It's still getting people sick. People are still dying. And the agency is searching for patterns based on patient age, gender, location, type of vaccine, variants, and other factors. Now, Joe was talking about, well, why don't you lose some weight? We just saw 76% of people who are in the hospital who are dying from this are obese. Why don't we do something about that? Why are we not talking about that? And then here again, around the world, there's 4.5 million deaths. We're almost at 8 billion people. That is nothing. That is absolutely nothing. And you could say, well, places like China are not reporting accurately. It's like, well, yeah, and I wouldn't be surprised about that. So let's just stick to the U.S. As of now, this was updated just August 30th here, so this is recent. 648,000 people. That's it? That's still 0.0001%, whatever that number was. It's like it's nothing. It's nothing. So the population of the U.S. is currently 332 million. And even with COVID, it's still a 0.58% increase from 2020. Even though COVID was going on, apparently it's not wiping everybody out. From political, I don't know what inf is here. Cancer runs in my family, and I don't do anything special for cancer. I do for my health in general, for all those reasons that I've already mentioned. COVID's even less. Accidents, asthma, stroke, Alzheimer's, diabetes, kidney disease, pneumonia. You know what? If you put all of these together, it's more than COVID. Put them all together plus cancer. I don't care. I don't care about any of these things. And all of these things are by far, hands down, more than this. So what is COVID here? This is U.S. deaths from COVID-19 so far compared to the top 10 U.S. causes of deaths in 2019. And here it's 500,000 by February 23rd. 500,000. Let's see if we can find a... Okay, strokes. 150,000. So if you were to multiply that by 3, are you going to care anymore? If 3 times as many people died from the stroke, are you going to start caring about stroke? It's like, no. It's like, I don't care about cancer either. So why are we doing this with COVID? Oh, here's another one. This is from... Well, I'll read this first. This is from another university. Masks only help if someone has symptoms. Nearly half of infections are caused by people who were either pre-symptomatic or asymptomatic. Since we don't know who is carrying the virus... What do you mean you don't know who's carrying the virus? I thought this thing is deadly. It is best to assume that everyone is infectious and wear a mask to protect yourself from others and to protect others from you. Who's this from? Loma Linda University Health. Oh, I thought this was in Indiana. I don't know where this university is here. They have some really bad wording in this. No, it was another one. I got rid of it. One of them was something like, does wearing a mask help? And it said yes. wearing a mask and social distancing and the vaccine will help prevent the spread of the disease. And it's like, no, 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 no. The question was, will the mask? Do not put in the vaccine, social distancing, washing your hands was another one. It's like, no. Tell me just about the mask. I could not find anything just about the mask and the mask only. And I saw all this information about wearing that N95 mask, that has a filtration system in it that is small enough and accurate enough that it's going to help prevent you from spreading COVID. But it also has a lifespan of only a few hours, just like those little blue surgical masks. It says on the box it's only good for 4 hours, and that's only for what it's good for. Whenever I was in the Army, again, we had personal protective equipment for chemical, biological weapons, and one of the things that they told you was that this is only going to work for a small handful of those things, and that the best thing that you can really do is, if one of those kind of attacks happen, is you better run and get the hell out of there. The first thing you did was you put your mask on, and then you waved your hands up like this, and you would yell gas, gas, gas 3 times, and you do that 3 times. Put on the rest of your gear, and then you hauled ass, and you got the hell out of there. And it's the same thing whenever you go and you get a new air conditioner and heater system, and they have filters. One of the things that they tell you to do is not to buy one of those really expensive air filters that it catches a whole bunch of particles, because what that does is that it clogs up really quick and it prevents circulation going from your heater and your air conditioner. Then it will freeze your AC lines that has the coolant in it, and then you'll stop getting cold air. And that's something that I've known to happen to people. And it's like, no, you don't get that. And it was, I didn't know at the time either, and so I had to actually call up my AC guy. And they were like, well, yeah, you got to get rid of that filter. That's why. So
push people in authority and power and hold, but now you'll follow lockstep incredible history, and then up close to the Canadian border, especially as a society in soccer, because they.
All right. So that's about all that I wanted to get from that. So again, this isn't about changing anyone's mind. I just want to bring this information to you so you can decide what you want to do for yourself. So one of the things that we did learn was that if you are obese, and also if you're the older that you are, the more at risk you are with this. So if I was older, if I was in my 70s or 80s, and especially if I was obese, yeah, you know what? I would probably go ahead and go and buy a mask. I might do more than just that, and I would wash my hands pretty frequently. But I wouldn't go around demanding everybody else go do this too. It's like, I'm not going to do any of this because I am young, I do work out, I do mind my health, I do these things, and I'm not going to pay the price because somebody else wants to eat. It's like, if you want to eat and you want to be overweight, that's fine, I don't care. But I'm not going to wrap myself up in a bubble in any way. Not completely, not over just my mouth, because of you. You made that choice. That's what you've decided to do for yourself. Fine, good, I don't care. That's what you did. More power to you. But this is what I'm doing. I didn't tell you to go out and lose weight. I'm not forcing you to do that. So you're not going to force me to take a vaccine or to wear a mask or anything else. Off of the information that I've heard right now. So let's go over any last things here. Questions that remain that need answers. Can you have the vaccine and still get COVID and still spread it? I'll change this a little later. So I have heard both to yes. Can you still get COVID? Yes. And can you still spread it? Yes. When you get vaccinated, do you have a better response to COVID? Joe was saying yes. I didn't pull up any information on that this time. But even if you did, it's like, well, you can still get it. You can still transmit it. So if that's still the case, then you would, it sounds like it would be better to just let your body kind of go through it, because if you got a bad version of it, a bad variant, then your body needs to fight it and to kill it off completely. Instead of having a vaccine that just kind of partially kind of keeps it down and it kind of stays in your system longer. It's like, no, your body needs to either kill it completely, or maybe it would be better if you passed away, or at least, if anything, is that if that's what happens, for at least to have you go off into the hospital and to be really quarantined from everyone so that it can run its course and not put anyone else in jeopardy. And then occurrences, dates, what would have made a change or a difference. I kind of had different intentions for this, but I'm going to kind of leave it as is. But an occurrence here, nonetheless, close enough. AOC puts mask on cameras and takes it back off. Former President Obama is having his 60th birthday party with around 700 people, give or take. And then another one is that, if this is so bad, this is from the FEE, the Foundation for Economic Education. And this is: massive nurse shortage hits Houston weeks after 150 unvaccinated nurses and hospital workers fired. Houston hospitals have reached a breaking point amid COVID-19 outbreak, which struck weeks after 150 hospital workers were fired by Houston Methodist Hospital, one of several hospitals struggling. COVID has been around for over a year now, and you fired 150 hospital workers? Why not fire like 10 people and then fine 10 people? Or the other way around, hire 10 people, get them trained, and then fire 10 people and keep going that way until you get to 150. Houston hospitals have reached a breaking point, which struck weeks after 150 hospital workers were fired by Houston. You're not going to tell me that after they fired 150 people and then just a few weeks later they were having problems? You expect me to believe that it was just like next to nothing and then just The first time that COVID went around, there were all these people who were just fine because COVID wasn't around, but if it came, they were going to die because they were obese, they were too old, whatever, yada, yada, yada. And so COVID comes around, and then they get it and they die. So the second go around, it's not nearly as bad because these people are dead. But you know what? Time doesn't stop. There are more people who turn 70. People are still getting older. And so all these people who are 70 and older, they're still getting older, and there are more people who are entering into that age bracket. There are still people out there who are not maintaining a diet. There are some people who are getting off their diet. There are some of these people who are getting sick with other things. One of the things that I've heard is that these people who are in the hospitals and who are dying, they have other issues besides just COVID, that it's only 2% of people who are dying from COVID are dying from only COVID. Only 2% of those people. The other 98% of people who are dying from COVID also have a pre-existing condition. I wasn't able to get into all this just yet because there's just a ton of stuff about COVID going on. Jennifer Bridges knew what was coming with her director at Houston Methodist Hospital, called her up in June to inquire about her vaccination status. Bridges, a 39-year-old registered nurse, responded, "Absolutely not." Okay, why are these medical workers saying, "I'm not going to get vaccinated"? What do they know? I don't care that she says yes or no. I want to know why. Did she know about this from the University of Chicago, saying that if you get vaccinated but it doesn't kill it, that it's likely to have a stronger variant mutate out of this because it doesn't get killed off? Did she know this? Why not? Why did she just didn't say no. They have it quoted as absolutely not. Tell me why. When asked if she was vaccinated or had made an effort to get vaccinated, she was terminated on the spot. This means nothing to me. I don't care. I want to know why. Tell me why. We all knew we were getting fired, Bridges, 39, told CBS News. We knew unless we took that shot to come back, we were getting fired today. There was no ifs, ands, ors, or buts about it. Bridges was one of more than 150 hospital workers fired by Houston Methodist hospitals. Why, though? Why? 150? And this is not the only one. That the Houston Methodist Hospital was one of several hospitals struggling. Why? All last year, through the COVID-19, we came to work, did our jobs, said Karen Shepard, a labor and delivery nurse who joined Bridges and other workers in an unsuccessful lawsuit. We did what we were asked. This year, we're basically told we're disposable. And I remember that. Last year, they were talking about, these are the heroes. These are the frontline workers and warriors and stuff. And it's like, no, you're not. You know why? Because they lie. Because that's what politicians said. Because that's what people wanted to hear. They wanted all this good stuff, but the politicians didn't mean it. You know, or any of these other people in positions of power. And that's why they're saying, screw all of these nurses, all of these medical workers. So Shepard and her colleagues may be disappointed in the eyes of the hospital administrators, but they are perhaps not as easily replaced or she or Houston Methodist personnel thought. And this is what Joe Rogan was talking about. He was talking about how he's getting these messages from doctors with PhDs and that they are too scared to come out because are they going to get fired too?
Go to a restaurant, to a gym, to the biggest percentage of people that don't have vaccines, that haven't been vaccinated, are people of color. So pro-diversity, it's fucking madness. Legitimate articles, Jamie, I'll send this to you now. There's legitimate articles, because doctors have been sending me these things. And, you know, this is neither pro nor con vaccine. This is not a judgment statement. But imperfect vaccination can enhance the transmission of highly virulent pathogens. Right. So this is a scientific paper from 2015 that shows.
Okay, so he's getting it too. Well, what is going on here? Why are they not telling us? Why can they not answer that question of why? Why did all of these medical personnel, trained individuals say no? To the point that they lost their jobs. That they no longer have income. It's like, what are they going to do? Go work at one of the other hospitals? It's like, well, which one? They're all having shortage problems. You know why? Because if you're not vaccinated, they're not going to fire you. So where are they going to work? What is it that is so strong and so compelling that they said, no, I will not get that vaccine? Or are you just trying to tell me that everyone is just too stupid to ask that simple one-word question? Why? So, I'm not afraid to ask that question why. I just can't get to it all. Because I am just one person. This is a lot of information that's took a good while to go over. And I want to share it with everyone else. Because I don't see what the problem is with letting everyone know what's going on. Because I don't know if you're a man or woman, young or old, in shape, out of shape. I don't know. I have no idea. So I'm not trying to change your minds. I just want to show you that, yeah, you know what? People are lying. We are not getting good information. So here it is for you. I brought this information so that you can talk it over Decide for yourself with your friends, your family, your doctors, whoever. I hope that this helped. If this is what you want more of, if you want to know the best for you, for your life, for your situation, give this video a like and thumbs up. That's all that I need. You can change your mind later if you want to. But if you've appreciated this and you want more, because I will definitely be doing more of all this stuff, give it a like, give it a thumbs up. Thanks a lot for watching. Have a good day. See you again later. Bye.